So I think a number of traits are important in speaking up, certainly courage and compassion, but I think there's also an element of perseverance and, not allowing sort of the challenge of that moment to get in the way of doing the right thing, of taking the right action, and, trying to help not only yourself, but potentially the others around you.
Really stating outright that expectation that we know people are going to make mistakes. So we know mistakes are going to happen. How do we address those mistakes, identify those mistakes, and move forward when that happens?
So I've experienced not so great safety situations, but then have had attendings in my own training who have laid the ground rules and said, ask your questions, we're going to talk about them. If I ask you a question and you get it wrong, it's a chance for us all to learn, and it doesn't mean that you aren't smart enough to be here. And so had both ends of the spectrum and have taken away pearls to try to use in my own practice with learners.
I had a situation the other night where I was taking care of a kid who was really sick and who ultimately died. And I felt when I went home that night, I let myself sit in the pain that was associated with watching that child die, with watching that family experience the death of their child. And that is something that I don't know that I ever allowed myself to feel when I was going through training. There was a need to sort of push it out of the way because there was sort of new things coming. And I always felt like if I had let myself experience that, then I would just be inundated with feelings that would prevent me from continuing to do my job. But I think that if you can sit with the pain for a little bit, then and let it just happen, then it's much easier to go out the next day or the next hour or the next patient and truly be present for them. And bring the same kind of compassion to their situation.
Maintaining well-being is a very interesting thing for physicians to be able to do in terms of character traits that I think help out with that the most. A lot of it is resilience and dedication. Wellness is not something that starts when clinical practice stops. It's something that is intentional and has to be pursued and has to be thought about very specifically in terms of being able to create that space for yourself.